Today we're talking about preconception, which is the period of time before one gets pregnant. And this is a really exciting topic for both Yasmin and myself because we are thinking about babies. I'm thinking about baby number 2. Yasmin is thinking about baby number 1. And I'm about to be 37 in December, and Yasmin is about to be 35 in December. So we just want to hear what advice you have for people who are in our age range, because typically once you hit 35, you hear a lot of funny things like geriatric pregnancy and it's going to be difficult and don't get your hopes up. So, what do you say to people who are in a situation like us?
I think that a great place to start the conversation is really with that idea of let's not get our hopes up, because so many couples trying to conceive at any age, we can really quickly get into a fear mindset where so many things, especially when we really deeply desire something, so many things can seem like an obstacle to us being able to have that thing that we desire. And especially when it comes to something biological or deeply rooted in our biology, we can quickly get into that part of the brain that there's a place of fear. So I think this term, let's not get our hopes up, or even the thought we're going to start trying but not really officially trying, or not trying not to conceive, and just kind of this like soft approach. It's nice, but at the same time, I think what it also sets people up for is maybe not really fully giving it their all in terms of the preconception timeline. And the preconception timeline is critical at any age or stage, but I think even especially at that, we talk a lot about that age, 35 years of age and older, when yes, a lot of changes are happening to both the quantity and the quality of egg health when we're talking about egg health, but same for sperm health. So when we talk about sperm health, a lot changes as the person who has the sperm gets older. So it's just really interesting when this is such a big decision and such an impactful decision in our lives. To be able to do everything we can to prepare is so important. And even though we know we can't control everything, why not just try to do as much as we can, not putting so much pressure on ourselves that we experience crazy amounts of stress, but really just to do everything that we feel we can to set ourselves up for something that the best possible outcome.
Yeah, and what I find so empowering, Corina, and I know, Karina's an advisor here at beeya, and she is working with me through my preconception phase and kind of, going through it. Even when Drew and I and my husband just started thinking about, okay, at some point in the future, we want to start, quote unquote, I guess, trying. And what I felt like was so empowering was there is so much that we can do in our life to just set us up for more of a success. I live, as everybody probably on the podcast knows, like I've lived such a stressful life at work. I'm quote unquote older. There's a lot of things that I would think would go against me, but just obviously knowing you, knowing the work that you do, it just felt very empowering for me to be like, you know what? None of that matters. And it's all about what can I do today to set me up for success in the future. So maybe we can talk about that and then go into the sperm aspect, because I definitely feel like we don't talk enough about the men. So, but let's start with what we can do kind of starting today to set us up for success.
Sure. So one of the best things that I ever did was to become more informed. I went to my OBGYN, thinking about conceiving. They basically said, take a prenatal, let's get your pap done and all that. Okay, great. But what else? I knew there was much more, and I understand there's only so much we can talk about in that kind of clinic setting, but I just knew there was so much more I could do. So I actually did talk to my naturopathic doctor at the time, and I said, okay, I want to do more. So what can we do? What can we test for? How can I learn more about myself through this process? And I learned so much. And not only am I talking about like my own person, but it always blows me away, because I'll start working with a patient or a couple who are thinking about conceiving, and they're thinking about their timeline. They might be on a 6 month to a year timeline, or shorter, or maybe longer. And they want to get to know what's going on for them. Maybe they're not feeling unwell. They feel generally healthy. And we start to dig, and it's not like we're looking for problems, but really we are looking for things that could potentially impact the health of future children and the health of themselves over time. And it's wild how much we actually discover. I mean, through my journey personally, I discovered that I had hypothyroidism, non-autoimmune hypothyroidism, that could definitely impact the health and neurological health of my baby, as well as increase my likelihood for miscarrying. So that was huge, as well as change and affect my cycles. How often would I be ovulating? How effective would I be able to get pregnant, at the age of 35 and older? So I got that under control. And then I learned that I had quite a bit of mercury toxicity. So I went through actually a whole chelation protocol. I never would have learned those things. Now, if I had gotten pregnant with high levels of mercury, gotten pregnant with uncontrolled hypothyroidism, there could have been major problems. I might have missed my chance to have my now very healthy girls. I'm not saying that we can control everything, because we know we cannot, but we can absolutely do our best to dig in and do everything we can to look for anything that could be a hurdle. And then once we go through that journey, it feels, there's something really soothing about knowing that you have done everything you can, and then also like leaving the rest up to the universe, really just saying like, okay, I did everything I can in the way that I could with what I am capable of doing. It might not have been everything, but I did what I could. I became informed. And then the rest, I'd like to see what happens. And because really, truly, when we're envisioning growing a family or having a family, the last thing we're envisioning is having children or child with a chronic disease, or for us to become sick through the process too. And we know that a lot of things are avoidable. The truly genetics play only a small part of that. In fact, we can really have a difference. And this is where it comes, like I get most excited, because as a naturopathic doctor, this is our medicine. This is like the epitome of preventative care. If we can impact the health of future people before they are conceived, it's like, that's just where it's at. I mean, when we think about even doing the work preconception with somebody who has eggs or who has sperm, we know that if they become pregnant with a baby with eggs, for example, we're impacting also like that many generations as well. So
Wow.
it's very, it's very fulfilling. And sometimes I'll have patients come in who are postpartum. They've been postpartum for years, and they've had issues or, concerns ever since a pregnancy, or maybe their kiddos have had issues. And sometimes I'm thinking to myself, I wish I had met you 6 months to a year before you conceived. Like what could we have done in that timeline?
I want to talk about this idea of the biological clock, because something you said earlier really struck a chord with me, where you said that males get older, their sperm quality also declines. And I don't think a lot of people know that. I think we all think that, okay, a man can get a woman pregnant or whoever pregnant until the day they die, and it's all good. But it's 50% of the equation, right? And
100%.
commonly, we're seeing more and more now that it's maybe not necessarily on the woman, it might be something going on with the man. So I want to hear a little bit more about this, because I think so much of the burden falls on us women, and it's nice to talk about like, oh, there's somebody else involved here too.
The current narrative around fertility in general all too often focuses on the woman as her responsibility, to become pregnant, to stay pregnant, to deliver a healthy baby, when in fact, not only is this unfair and biased, this is scientifically incorrect. So we know when couples are having trouble conceiving, it is a 50-50% chance that it is I like to use the term egg factor or sperm factor, even though we know that there are many more things that can occur than egg. There's uterine, there's cervical, there's all sorts of other things, but I use those to degenerate those terms. But we know that it is pretty much a 50-50% split between what is termed male or female factor when things are not going as planned. We also know that as sperm, so we talk a lot about egg aging and egg health and quality decline, but sperm quality also declines. It's a slightly different timeline. We think 45, 50 years of age typically, and it's starting to be developed in the research more, but typically for men and older, we see increased rates of chronic disease in little ones with older sperm. So if we were comparing that to, say, younger sperm, same age egg. So it is really interesting, and there's more information coming up. But basically, the truth of the matter is it takes healthy sperm and healthy egg to make a healthy embryo, period.
I love this. We need to talk more about this, because I feel like, even with me knowing that being in this space is 50% egg, 50% sperm, or egg quality and 50% sperm, I still felt pressure when I even thought about, oh, okay, Drew and I are ready to go into this phase of our life. Just even though I know it's 50% men, but I just think we need to talk more about it because it's so key. So if somebody's listening right now, Corina, and they're like, all right, like I know it's important for both me and my partner to start living a healthier life. What are maybe some of the top three most basic things that they can start doing today?
What I like to think about and contextualize is like, let's think about our external environment and let's think about our internal environment. On the aspect of our external environment, there is a whole lot that can become a hurdle to conceiving. So we know that, for example, environmental toxicants, although it's being talked about more, it's still not being talked about enough. We see overall a huge decline in not only sperm quality and motility and morphology, which is the shape of the sperm. We are seeing that decline over the past 20 years exponentially, in fact, and suspect in so many cases that it is influenced by, in a large part, the environmental toxicants that we're so easily exposed to now. And same for egg quality and even egg quantity. And also, a lot of these toxicants are termed endocrine disruptors, meaning hormone disruptors. So not only we're talking about like those gametes or those reproductive cells that they're impacting, but how they're impacting all the processes that are needed for sperm and egg to meet, really. Like the thyroid has to be working super well, blood sugar and insulin need to be in good shape. Our actual hormones that are produced by a growing egg need to be able to be received and not be influenced by endocrine disruptors. So external environment, really examining the environmental influences. And also, like, what are we taking? What kind of medications or supplements, even botanicals, are they getting in the way of our fertility? Or are they not quite the right fit? Or are they contaminated themselves? That's a big question too. Or are we using things like lubricants that are not quite, if we're in a hetero relationship, and are they not quite sperm safe lubricants or something? There are a lot of things to discuss in terms of the external environment. When we're thinking about the internal environment, we want to think about our own bodily processes. Maybe there are existing health conditions that we want to explore and start to work on. Some of the top two when it comes to egg health are thyroid and PCOS, or polycystic ovarian syndrome, as those can influence the top reason why people with eggs have trouble getting pregnant or ovulating. It's ovulation is the top number one reason when folks have trouble conceiving is ovulatory dysfunction. So if we can examine anything that could be influencing the internal environment, influencing the likelihood for us to be able to ovulate, have regular healthy cycles, and then of course things like nutrition, diet, internal influences, also including things like stress, which we know is a big one too.
What's so cool about everything you're saying is that whether or not you want to have a child in the near future, these are all principles we talk about a lot about just overall good health. So it's just very motivating to do all this stuff now, even if you're not thinking about having kids anytime soon. But I'm curious, for someone who's like, all right, I'm going to sign up for your course. I'm going to learn more about how to get me and my husband's nutrition or partner's nutrition better. How long does it take for your egg quality to improve and also sperm quality to improve?
So for eggs, they go from a primordial or a very baby state to a fully mature state over the course of an entire year. But in the final 3 to 6 months, there's a huge ramp up. And in fact, there are a bunch of different follicles, or the sacs that are holding the eggs. There are a bunch of different follicles competing to be that one to release an egg every month. And during that last 3 to 6 months, we have a much bigger influence on the health of the egg and all of the fluid and nutrition and things like that that contribute to the health of that egg that's being released. So I really like to focus on the full year. What we call folliculogenesis is the maturation process of the egg, but especially in the last 3 to 6 months, if we want to make a big influence. And actually in the research, we see that too. So when we're studying natural therapies or non-natural or conventional therapies, medications and things like that, that influence the health of someone's fertility, you'll often see time points checked at baseline and then 3 months and then 6 months. And that 3 month window is precisely because of that folliculogenesis, or in sperm health, the spermatogenesis, or the development of sperm. So it's sperm turnover about every it's a 3-month window pretty much. So it's a shorter window for sperm, but 3 to 6 months we like to think about we're influencing the health of the sperm. And my colleague, Dr. Korn, who is this is his thing in fertility and hormonal health, in how it influences sperm. It's really exciting. So he'll be speaking during the course all about how to influence that sperm health.
I remember when I was thinking about getting pregnant the first time, and I was talking to my boss, Dr. Mark Hyman, and I said, I'm thinking about like six months from now. The next 6 months, I really want to just dial in. I probably spent about a year, which I know is like very intense, but this is my like world. I'm in it. I'm saturated in it. So it felt exciting to me. But I spent about a year getting ready, and then 6 months like really ramping it up. And I said, what would you recommend? And he said, you got to get all of your vitamins and minerals up. Just get get all of your nutrient density up. And so obviously a big part of that is, and then, look at environmental toxins, look at mercury, look at all of that. But he was like, you want to just be getting like the highest amount of nutrition right now. So a big part of that is a prenatal, but what does a nutrient dense diet actually look like?
Yeah. So nutrient dense diet, I often just go to the super basics, but I think it gets really confusing, like what those basics are. And people are constantly coming in and saying like, what does that mean? And Dr. Hyman talks about this all the time, right? How hard it is to determine that. But let's focus on really good balance and not skipping meals to start with. This preconception time is not a time to do a lot of intermittent fasting, in my opinion, or to be skipping meals and setting ourselves up for intense spikes or dips in our blood sugar, for example. So really focusing on getting the day started with some good protein and fiber and fats. It's like, and then color, lots of fiber, fats, protein, and color. Like those 4 basics in every single meal, and then not skipping meals that's a pretty good place to focus. Focusing on things that are less packaged. So, you're really getting to those whole foods. And then really setting ourselves up for good blood sugar balance throughout the day. So if we're setting ourselves up in the morning with a good amount of protein, and then we know we're building in some color or some fiber with that meal, we're going to set ourselves up right away for a good balance over the course of the day. And then if we're making sure we're not skipping our lunch and we're not pushing past that, being so busy and skipping that, then that's a really good place to focus too. And then in terms of like in the toxicant exposure, really focusing on organic as much as possible when it comes to, but if we're budgeting and, focusing on avoiding the dirty dozen is a great place to start. So those are the kinds of things that I like to mention. Of course, beeya seeds, of course, like we have to talk about beeya because beeya is amazing. And it's something we developed, to help it's just something that's so nice because you can add it in so quickly into the day, increase your fiber, increase your nutrient density, and add that in the morning or in the middle of the day. But it's like such a nice complement to all of this because it's such food as medicine, and it can set us up for great cycles and can set us up for some of those really rich antioxidants delivery. So lots of color, the rainbow, and lots of diversity, 30 to 40 different types of plants or different fiber types or types of plants throughout a week, really changing up the things we're eating, at least like for lunch and dinner, maybe consistent breakfast. So it makes it easy for you in the morning. And then making sure you're getting enough protein in the morning and then throughout the day, and less processed is best.
Yeah, I also want to ask quickly, because something that I've heard some women say in the past is that they're really not looking forward to giving up alcohol and marijuana while they're pregnant. And I pause because I say, well, giving it up when you're pregnant, how about giving it up before you get pregnant?
Exactly.
Because these things can actually really impact both the sperm and the eggs. Can you talk about this?
Yeah, of course. So while the research is constantly being developed, what we know about alcohol and how it impacts egg health versus sperm health is different. We know that the threshold for tolerability in terms of the amount of drinks per week and how that changes or influences fertility for egg health there's a lower threshold. So more than 2 drinks throughout actually, this is in the research, but more than 2 drinks per day can greatly decrease time to menopause, which tells us greatly decrease not only the number of eggs that are going through their natural kind of death cycle, but influence that probably the quality of eggs as well. It can increase the rate of infertility by 60%. So that's 2 drinks per day for egg health. But I like to say, let's focus on where the research is. We know a lot about like cancer research, especially around, how alcohol impacts our antioxidant levels and our likelihood to develop things like cancer. So we especially breast cancer. So I like to start there for egg health. I say, 2 drinks or less per week, but also let's examine why we're drinking to begin with, and maybe practice this, like use this time to say, what else can I do? If it's something I'm using to wind down, what else can I do? What is it that makes me want to drink? And is there something else that I can try to bring in just as a practice? Because during pregnancy, there still truly is no safe amount of alcohol. So if you're already headed in that direction, start practicing now. Set yourself up for the maximum chance of being able to not have anything inhibit the fertility or decrease our chance of being able to conceive again, like I said. And also, alcohol is really intense on the body. It is very intense for the liver. And so if the liver is bogged down by any amount of alcohol, and as we consume less, our body has trouble even breaking it down even more because we decrease the amount of enzyme available to break down alcohol. So even if we're drinking very little, just a little bit can make a difference for us. So it's interesting, the alcohol conversation is very multifactorial and layered. I like to just think about it as practice. Like we're practicing just not having it during our pregnancy. So practice now. Give yourself that 3 to 6 month window. Like you were saying, really increase your nutrient density in your body, really focus on that, and really ramp it down when it comes to drinking and alcohol. When it comes to things like marijuana, so THC, just in general, the THC research is interesting. We know that for egg health, it can greatly impact cycle health. It can impact oxidative stress, increase oxidative stress for the eggs and the sperm, and increase DNA damage to the egg. So again, what is the amount? That is a bit unclear, but we know that there can be an impact. So again, practicing, why do I need this? What am I using it for? Are there other ways? Because if that's the kind of pregnancy we want to have and the chance of conceiving the healthiest baby or babies possible, it's a good time to start reflecting on that.
Now, a question that came up, caffeine. What are your thoughts about caffeine intake in preconception time and during pregnancy? This is clearly one that I'm very personally curious about. So tell me the realness around it, Corina.
Okay, I'm going to break it down in like, here's the research and then here's what I think.
Okay.
So in terms of the research, about 200 to 250 milligrams or less per day when you're in preconception and then in a pregnancy itself is what's recommended. But here's what I see. There are people who handle caffeine better than others. There are constitutions who do better with caffeine than others. If you're somebody who gets really wound up from caffeine, any form, whether that's tea or coffee, maybe examine also if there's an opportunity here to start winding that down, because maybe other things are happening when we're wound up from those stimulants. Like maybe it's impacting our sleep, for example, which is critical for the health of the egg. So what I really think about it, in terms of outside of what's actually in the research, is caffeine has an energetic imprint. Different caffeine types have different forms of energetic imprints. We know that, for example, coffee as a plant, as a botanical, is more depleting than, for example, green tea. And for a lot of people, they feel different. Some people will drink green tea and say, I don't get, and that might be because of the L-theanine in there. That might be because of other aspects and antioxidants are in green tea. But maybe with coffee, they might not feel, they feel a little bit more like they stole from tomorrow what they didn't have for today, kind of that idea. I know I certainly feel different when I drink coffee versus drinking green tea. So I think examining like how your body handles different forms of caffeine, if it's even necessary, if you haven't even taken a break from it, ever, maybe examine like, could I take a break and actually get an idea and kind of gauge what my energy truly is. I remember I had an Ayurvedic doctor at one point who told me to straight up just go off of all caffeine. And I did for a long time. And I really, I think it was nice to just know when I was actually being tired from other things outside of maybe a spike or dip in the caffeine, right? So I think it's a good opportunity to start thinking, what is the energetic imprint? And then I think there's an energetic imprint during a pregnancy too. Personally, this is my bias, right? So I am somebody who does not do great with too much caffeine at all. Like, I'm not somebody who has ever been able to have too much of it. And so during my pregnancy, I just stayed off of it. But it is safe in pregnancy to have to a certain extent. But for me, it was like, I know if I get really jittery like this, I'm sharing that blood flow with the growing fetus. Like, I don't want I don't want to share that kind of same, like, it doesn't feel so settling into my nervous system. And so I think about that piece.
Yeah, I felt the same way actually. I was happy that my body rejected coffee for me when I was pregnant. Like, I just felt nauseous. I felt like, crazy when I would drink it. And I was like, okay, I don't even have a taste for it, which is kind of nice
Yeah.
during pregnancy. And I felt the same way, that anything that's like ramping up my heart rate, making me feel a little bit off track, like my baby's going to feel that too.
Yeah.
And I don't, we can't control everything that our baby feels. Like, we don't want to. And, life happens, but we can do our best for sure. I'm wondering, in your opinion, how long should a couple be trying before they seek out help?
Okay, so I like to reverse that question a little bit. Like, let's go ahead and do a deep dive in this preconception period, do a lot of the uncovering that typically is kept until 3, 6 months, or a year down the road of trying and having trouble conceiving. Let's do a lot of that work in advance. So maybe in advance we get a semen analysis. Maybe in advance we get some of our basic labs completed. And then if we want to do a deeper dive, we can do a deeper dive too. But standard of care recommendations are, if you are 35 years of age or younger, waiting a year of trying until you officially undergo like a full investigation, and that includes imaging and that includes lab work. And then 35 years of age to 39, it's the 6-month period or more, having trouble conceiving. And then after 40, it's a much shorter timeline. And those timelines change depending on if we have a known medical condition that can influence our chances of conceiving, like endometriosis, for example, or PCOS. So, or maybe we've had a history of being treated for a cancer, we have a chemotherapy exposure or something else big in our kind of medical history, then that timeline may change. But I like to kind of reverse it and think, let's do a lot of advanced discovery, and then there are layers to add in farther along down the road if people are still having trouble.
I love that actually, because I think that, not that preconception time should seem like a chore. It should be as much as it can be, a joyful time. Sometimes it's not. Hopefully it is for most people. But I love that, because I think so often people are told, just try for a year, do everything that you're doing now and just try for a year and then we'll look into stuff. Yeah. Well, that's a whole year that, they could be working on nutrition or getting their toxins down or looking into thyroid or seeing if there's something actually deeper going on inside the body. So I love this reframe of like, let's get all the information first and work on it. And then if we need to dig deeper, we can, which is, I think, a lot of what your course is about. Is that right?
Exactly. So, and we're talking about not only making this transition into the timeline of when we're trying to conceive, and then hopefully being able to conceive more easily on a timeline that we're hopeful for. And also, once we have a child or children, that we set ourselves up for being the healthiest parents we can on the other end, right? So if we're doing this work in advance, we're hopefully setting ourselves up for, and in my opinion, yes, healthier kiddos. And from what I've seen, yes, in my practice, so many healthy kiddos, which is wonderful. I don't think it's like just by chance, but we're working on that in advance work. And then we, having our kiddos being healthier parents too, to be able to show up as the kind of parents we want in the long run. I think it's, getting as much, and I realize this whole thing, there's so much that comes with it, right? There is, whether you are somebody who has been trying for a while, who has had trouble conceiving, maybe you've been through pregnancy loss, maybe you've been through multiple pregnancy loss. And some of the stories that I hear are just traumatic, and so I understand this idea, like, let's give ourselves grace. Let's not put so much pressure on ourselves. That's not the goal here at all. The goal is really for people to feel informed, empowered through the information, not to, and really what helped me feel less stressed is just being informed. Like, take one foot, put it in front of the other, do what you can, know that you did what you can, and the rest is kind of just up to something else, quite honestly. But I think, yeah, I think it brings up a lot because everybody's journey is quite different, and we're not all set up with the same circumstances. So that's not always our choice or our ability to control. But information is empowerment, and it's 100% the case.
It's so true. And I will admit, before I was informed and working with you and learning more and asking Kea questions and understanding, it definitely felt like a chore. And I remember thinking to myself, gosh, like my day to day, some days are very overwhelming. And now and I'm trying to just like have 3 meals a day. And now I'm thinking about, oh gosh, what do I need to do? Like, do I have to go to an acupuncturist? Do I have to do this? And I remember scheduling time with you and us just kind of talking and working through it. And I truly felt like, as I was more informed, which you mentioned a few times, and I just want to underscore that, it really has given me a sense of like peace, and the anxiety piece is no longer there. And it truly doesn't feel like a chore. So I'm just sharing that if anybody who is listening is like, oh my gosh, I'm just trying to keep my health in place, and now I have to think about this, because it can seem very overwhelming, but just learning what you can do is very helpful. And, a lot of people also reach out to us about what lab test should they get? And I think, once we did my own labs, I was like, oh, okay, I feel just very comforted, right? Knowledge is power. So what would you recommend to someone who's listening, who's like, all right, where do I even start when it comes to labs, just to kind of see my overall health?
Yeah, that's so focusing on that internal environment, seeing what our status is now. I feel like there are two layers. So there's a kind of a more like not basic, but a comprehensively basic layer, and then there's a diving deeper. And depending on resources, this is why I like to break it up like this. Here's like the more important test to get started with, and then there's a diving deeper. So the more important test to get started with would be understanding what your hormone profile is. Are you ovulating? Trying to figure that out. Getting a very extensive thyroid panel. And I'm talking about egg health, and this also applies to sperm health too, but looking to see what the blood sugar and insulin are doing, looking to see what the comprehensive metabolic panel and comprehensive blood work for your immune cells, seeing if you have any forms of anemia, any straight up vitamin deficiencies. Things like even vitamin D, can influence the health of a growing child and their even bone health and immune health. So a growing embryo. And influence our cycle. So there are a lot of things that we can get on like a more comprehensively basic level and just start there. And then also the diving deeper. I get excited about diving deeper always, of course, because I just know what comes up from this work. But it's all a matter of like, okay, here's what I can do. I know I can do this. This works with my budget. The other stuff, I'm going to have to just like, it's okay. The other things diving deeper might be like a more comprehensive look at our antioxidant status, our fatty acid levels, toxicant exposures based on labs. And that might look like a metals test, urine and blood. Things like mercury and lead very much can influence the health of a growing fetus. A gut microbiome test, looking to see if there's any celiac or non-celiac gluten sensitivity. We know in cases of unexplained infertility or subfertility, that can play a role. So, if that's influencing your body's ability to absorb nutrients and vitamins, it makes sense to do that workup. And that one can be done through insurance for a lot of folks. So and then of course there's genetic testing too. That is standard of care to offer. So if we want to do a genetic test to see what's going on, is there any likelihood we're carrying a recessive genetic trait that might influence the health of our offspring, then let's look at that. So there's the more basic labs, and then there's a going deeper, and a lot of the like comprehensively basic can be run through insurance. And then there's a hormone that you can check to see what your egg reserve is if you're interested. And then of course semen analysis, and a lot of these same labs that I just mentioned do apply to sperm health. So definitely looking at the labs. And I want to reiterate what you were saying about just having like this, kind of the anxiety relieved, because anxiety is such a big part of this journey and can be, I think most every single person that goes through it at some point, most of them experience some level of, unless it's like it was just almost accidental, or they got pregnant on the first try and they weren't really thinking about, okay, so there is this piece to address. And I do think that having a plan in place, just kind of walking through the motions, putting one step in front of the other, looking ahead and saying, if we are trying and we're not pregnant by this time, then the next step would be this, and kind of laying it out like, here's a good plan. If, we get pregnant with this timeline, great. If we don't, here's the next step. And I did want to mention that I have an amazing colleague, friend, Dr. Shruti Mahangaya, who is works at Harvard Medical School. She's also at Mass General Health as a reproductive endocrinologist, and there will be an interview with her that is part of the course that she'll talk about what it looks like through the process of how much does it cost and what does it look like at those next stages. If you're thinking about freezing your eggs or sperm or going through IVF, what does it look like? What are some tips that I can take just to prepare my mind if that is going to come? I think, though, that generally speaking, most people are thinking, okay, I'm trying, and then if I'm not trying, I'm going to IVF. But I feel like there's also this really big in-between space that's just not being talked about enough. So that's what we're doing. Dr. Korn is also a fertility and hormone specialist, as well as myself. He will be talking and teaching all about sperm optimization and overall sperm health and body health for optimal sperm. And then I'll be focusing on the egg health part. But it's really nice to be co-teaching with somebody who actually has sperm and who really focuses on that part.
That's so awesome, Corina. I feel like, Yasmin and I talk a lot about how we are both workaholics. I think we're all like women who love to work, we love to serve others, and it can feel really hard sometimes to invest time in taking care of yourself. And so for me, what was really empowering about the preconception time was that I wasn't just thinking about myself, I was thinking about a baby. And so this was the only time in my life where I was like, I don't feel guilty for putting in all of this investment into myself. And I know that shouldn't be the case. Like, we should want to invest in our own health, but sometimes it's really hard for a certain personality. So I know it can feel like a very stressful period of time, but it's, as much as this is a time about getting pregnant, it's also a time to take care of your body, your partner's body, to really look into your health, to really set the foundation for great health. So if anybody's interested in this course, tell us a little bit more about it. When does it start? How do they enroll? Who's it a good fit for?
So it's starting very, very soon. In fact, doors have opened at when this conversation airs. Doors will have opened. It's called Preconception by Design. It is for individuals or partners. It is for people planning to conceive someday in the future. For people who are struggling to conceive now. It is for people considering freezing their eggs or sperm. It's a 6-week course that is both recorded lessons and that you can watch anytime, and then live Q&As. We have several different experts we're bringing on: a nutritionist, we have an environmental health expert, and then a reproductive endocrinologist to talk all about reproductive technologies. And then you basically get access to this resource vault, direct lab ordering. We're going to talk about labs. We're going to talk about supplements. You also can have the option to work one-on-one with some of us as well. We have like a VIP offering for a limited number of folks. And then, but really the bones of this course are so fantastic, because by the end you're building a blueprint, and that's the preconception blueprint that we feel like we can so easily get this information out to a wider audience. Like, it does not need to be kept in the container of a one-on-one appointments. More people, we want more people to have access to this information. And so that's what we're doing. We want people to feel like they have a blueprint, that they know they can take one step and put it in front of the other, have a plan, feel like it's an evidence-informed plan, feel like they have that information to feel empowered, less anxious through the journey. And we're excited. This is the first time we're launching, but it's been brewing for a long time. So
I know it's been brewing. You're so passionate about this space. So it's so cool to see your vision kind of come to life and your knowledge just really helping so many women. And I know we're coming up on time, but I always love hearing people's examples or case studies, because what you said really was interesting a little bit earlier, where you said, let's say someone tries to get pregnant for 6 months, they go straight to IVF, and you're kind of the in-between. We don't talk about that enough, because I actually have a lot of friends that are like, oh my gosh, 4 months in, I didn't get pregnant, I'm going to go to IVF. And I'm like, oh, is that what you do? So I don't know if you can maybe share one of your patients or a case study, but it's always just so empowering to hear from real life examples of someone in that stage.
Yeah, I have so many. And actually, this week was really wonderful because I had 3 patients reach out and say, we're pregnant. And those are always like wonderful days. It's like, okay, we're doing this. It's so exciting. And I also love it when I get to support on the other end after their pregnancies and the postpartum journey. But for example, I do actually have quite a few referrals from IVF clinics. So people might be going to IVF already and have trouble because that's not a guarantee either. And so maybe they've had trouble with their transfers of their frozen embryos and the embryos didn't take for whatever reason, or maybe they've tried to produce a certain number of eggs and they're not getting quite the amount that they hoped for, or something's not going as planned in the process. So those might be referrals to me, or they've been trying and they are like, there is an in between and they come to me. So some of those examples might be, for example, we start focusing on their gut health. Maybe there are cases, and a lot of times this is the case where I'm thinking outside the box. So a lot of times my outside of the box thinking will apply in that environmental toxicant aspect or in like the gut health aspect and in kind of the overall, what are they taking and doing? So it's really multifactorial. Like people want to focus in often on like one thing that they need to do differently, but it's really like, we're going to take all of these ideas and put it together and it's going to make the difference as a whole. In terms of gut health, what are the things that they're sensitive to? What is going on with their microbiome? Are they having any issues there? Do they have IBS or inflammation, or is there some sort of signal there that their gut is upset? If there's inflammation and there's an immune aspect involved, that can very much influence things in terms of the body's ability to hold on to a transferred embryo or conceive in general. So we try to bring that inflammation down through focusing on the gut, definitely wanting to look at the toxicant exposure profile, make sure that's reduced significantly as much as possible, and then also support them as much as possible with any other pieces that are missing in terms of nutrients or botanicals that might help. So, and knowing what's safe during this time too is important. So getting the information out there is going to feel really, really good. Oh yeah. So a lot of those cases who have been referred or who do choose the in-between to focus on this, they end up being able to conceive. And it's always like so reassuring and so reaffirming, I should say, to see that like, oh, okay, they did the work and now they're able to conceive as they had hoped. And so those are really heartwarming stories and they happen a lot. And it's like, so of course, not every case, but it's like more than not.
I love that. We get a very small taste of it at beeya when people say they've been using the seeds and it's been part of their preconception journey, or they were like having trouble with fertility before and now they're pregnant, and it's literally like a birthday party. It's the best feeling. Yeah. So this course sounds really comprehensive and amazing. I know a few people that I want to share it with. So thanks for putting this together. We're going to be sharing all about it in the show notes to anybody who's interested. And thanks for being here.
Thank you for having me again. Always such a joy. I love beeya. Thank you, ladies.